Good evening, everyone. My name is Michelle Nunn, and I'm the president and CEO of CARE USA. CARE is a global humanitarian organization that's been fighting poverty and alleviating suffering for 76 years. Throughout our history, we've responded to humanitarian crises, conflicts, and extraordinary challenges. But the impacts of a global pandemic have truly challenged all of us to adapt and to work in new ways and to adopt bold new approaches. CARE has seen firsthand how COVID is impacting communities around the world, especially how it impacts those who are most vulnerable and how it is greatly increasing poverty and hunger. That's why I'm so glad to be joining you on this first day of the People's Summit to end COVID now. This is truly a time for urgent solidarity. If there ever was a time for joining together and recognizing our interdependence, it's surely during a global pandemic. But to date, we, the US, and the larger global community have fallen short in our action. And it's what draws us together now. Together, we, the people, can push for the changes that we seek, for the changes that will truly end this pandemic for everyone. As the US government and its partners prepare for the second global COVID summit this week, we're gathered in action to insist that we end this pandemic for everyone, everywhere. American ingenuity and investment created miracle vaccines that have saved so many lives. But around the world, the pandemic surely isn't over. Fewer than 16% of people in low-income countries have received one dose. And in many low and middle-income countries, women have been less likely to get COVID-19 vaccines than men. Whole systems are suffering because of it. Twice as many women and children have died due to the pandemic's disruptions to the health systems as they have from COVID-19 itself. But it's not too late to make sure that the resources for responding to the pandemic are equitably distributed. By investing in last mile delivery and in healthcare workers, we know that we can turn the tide of this disease. We can ensure that people around the world have the access to the vaccines and the treatments that are available to those of us who are living in the US right now. CARE is one of the largest humanitarian organizations in the world. Yet with COVID, we faced some of the biggest challenges in our entire history. We've stepped up to that challenge, and we know that change is possible. CARE assists with COVID response in 70 of the 100 countries that we work with. That includes direct support for vaccine delivery at the last mile and the hardest to reach populations in the world. More than 100 million people have been vaccinated in areas where CARE supports vaccination rollout. And our media campaigns with COVID information have reached close to 400 million people. But vaccines alone are not sufficient to mitigate the harms of COVID. Not just the supply, but we must invest in transporting and delivering and administering these vaccines and reducing the strain on overburdened health systems and health workers. Vaccines sitting on tarmacs are simply wasted. We need shots in arms. So the time to invest is now. And we need to invest in equitable COVID-19 vaccine delivery and treatments around the world by meeting huge funding gaps. We need to invest in the pay and the support and the protection of frontline healthcare workers. And we need health systems that are strong enough to maintain routine, essential health services, including sexual and reproductive health services and other essential vaccines, even during a pandemic. CARE is determined to ensure that the world's most vulnerable people are not forgotten. And we know that this is not just an act of generosity, but of protection. Without vaccinating the world, we risk future variants globally, a prolonged pandemic here at home, and the possibility of up to $600 billion in economic damage just to the US. The global COVID-19 pandemic represents a truly all hands on deck moment. A moment for governments, for INGOs, for local community organizations, for the private sector, as well as everyday citizens to play a role. So we're calling on Congress right now to pass at least $5 billion for global COVID response immediately. We can't do this without you. So please stay engaged, call your representatives, and tell them to keep COVID-19 a priority and to join CARE and so many others as we fight the pandemic alongside women and girls around the world to build back a stronger and a more equitable future for all of us.